Maxey. I'm a BSN student at Nevada State College, and I will be performing a head-to-toe assessment on you today. Can you state your name?
Zachary Katzen.
And how old are you?
18.
And when is your birthday?
December 12th, 1995.
Okay, Zachary, can you have a seat? Do you know what year it is?
2014.
Do you know what city you're in?
Las Vegas.
And who is the president?
Barack Obama.
Do you have any history of any diseases?
No.
Any history of any trauma?
No.
Any history of any surgeries?
No.
Do you take any home medications?
No.
Do you have any allergies to any medications or
No.
anything? And do you drink
No.
alcohol? Do you smoke?
No.
Do you use any street drugs?
No.
Okay. And Zachary, do you work?
No.
Do you exercise?
Yes.
How often do you exercise?
4 days a week.
And what type of exercise do you do?
Weightlifting.
Do you go to school?
Yes.
And how often do you do that?
4 days a week.
And do you eat 3 meals a day?
Yes.
Okay. And Zachary is 18 years of age. He is alert and oriented. He is sitting erect. His posture is erect and calm. Arms are at side. And he is with correct eye contact. His facial expressions are appropriate for the situation. His mood is appropriate as well. His speech is clear. So Zachary, what I'm going to do now is check your eyes. Your eyes are bilaterally symmetrical. Eyelashes are present as well as eyebrows. There is no drainage from either bilateral eye. Sclera is white. And I'm going to perform a light reflex and a accommodation test on your eyes. And you're going to, I need you to look at me, and then you're going to feel light come in from the side. Okay. Eye with constriction. Eye with constriction. Bilateral eyes with constriction, approximately 3 millimeters. Cornea is smooth with no opacities. Iris is round with even color tone on bilateral eyes. Pupils are black and round, and eyes are perla. I'm going to have you look over here at the wall. I want you to focus on the wall, not on me. And then I'm going to have you focus on another object. Okay, now I want you to look at my finger. And bilateral eyes did constrict. Eyes are perla. Now, Zachary, I'm going to check your nose. Nose is midline. I'm going to close one nostril. I want you to breathe in with the other nostril. I'm going to check for obstruction. Okay. Other one. Breathe in and out. Bilateral nostrils are patent. No obstruction. Nose is midline. Skin is even toned. Few little bumps on the face. Otherwise, skin is intact. Lips are with no cracks. Looks moist. I'm going to check your throat. I'm going to have you open up your mouth. I want you to say ah. Hold on one moment. Okay, tonsils are +1. Can you open up your mouth wider, please?
Oh.
Ah. There you go. Uvula is midline, rises upwardly. Soft palate also, sorry, rises midline and is appropriate bilaterally and is smooth. Gag reflex is present. Sorry about that. Mucosal is pink bilaterally both sides. Gums are pink, lower and upper gums are pink. Now I'm going to have you stick out your tongue for me. Tongue is pink with a thin white coat. Now I'm going to have you open your mouth again and stick your tongue up to the roof of your mouth. Ventral side of the tongue is pink with veins present. Saliva is present. And tongue is midline. Now I am going to check your facial muscles, and I'm going to have you clench your teeth. Okay. Now I'm going to have you squeeze your eyes shut. Good job. I'm going to have you wrinkle your forehead. Good job. I'm going to have you puff out your cheeks. Okay, I'm going to press on your cheek. Good. And the air equally came out of the mouth, and facial muscles are intact with facial expressions. Now I'm going to check your ears. Ears are with no swelling, no thickening, no drainage present. And other ear is also with no thickening, no drainage, no swelling present, no lesions. Bilateral ears. Bilateral ears are symmetrical and even. Okay, so now I'm going to have you check your neck muscles. I'm going to have you put your head forward and backward. And then I need you to go side to side. And then I need you to go ear to shoulder. Okay, neck is bilaterally symmetrical with smooth motion. There was no noted bumps or lesions on bilateral neck. Now I'm going to be checking for your trachea. And the sternal notch and slide. Trachea is midline and no bumps or lesions in the neck of the trachea. Okay, now I'm going to listen for your carotid arteries. And what I'm going to have you do is take a deep breath in, or just breathe in, and then I want you to hold your breath briefly while I listen to your arteries, okay? Okay. Go ahead and take a breath in, and then hold it. Okay, go ahead and release. And I'm going to do it to the other side. Okay, no bruit present and bilateral carotid arteries. Nice. Now we are going to have you lay down. And I will be checking your abdomen. Okay. Abdomen is flat with no pulsations present. Skin color is even in tone. No lesions. No striae present. No scars present. Umbilicus is midline with no hernia or no swelling. Now I'm going to listen for your abdomen, and I'm going to listen for any bowel sounds that you have. Good. Bowel sounds are present in all four quadrants, normal active bowel sounds. Now you're going to feel a tap. I'm going to check for any masses or tenderness and sounds of your stomach. Okay, bilateral upper quadrants, right and left, with dullness. Bilateral lower quadrants with tympany present. Now I'm going to perform light palpation. You're going to feel just a small push, okay? And I'm checking for any tenderness or possible masses. Okay. Did you feel any tenderness anywhere when I pushed down?
No.
Okay, now I'm going to push a little harder, okay? Okay. Any tenderness, any pain anywhere?
No.
Okay, so no tenderness, no masses palpated on any quadrants. Now I'm going to have you sit up and I'm going to check for your kidneys for any pain. Go ahead and scoot a little bit up. There you go. Okay. Did you feel any pain?
No.
Any pain?
No.
Okay. All right, so now I'm going to have you lay back down. We're going to do the range of motion on your feet, your legs. Sorry about that. Okay, so I'm going to have you lift this leg straight up, your left leg up and then down. Now I'm going to have you lift your left leg up and I want you to bend it. Okay, now I'm going to have you turn it inward and outward. And outward. Okay, good. Now I'm going to have you do the same thing with your other leg. I'm going to have you go straight up with your right leg. Okay, down. And then I'm going to have you bring it up and bend it. And then I'm going to have you move it inward and outward. Okay, good job. Bilateral lower extremity motion is intact. Patient with no difficulties of moving bilateral lower extremities. Okay, now I'm going to have you sit up here at the bedside. Come on. Thank you. Okay, go ahead and relax your legs. Are you okay sitting right there? All right, so now what we're going to do is check your reflexes. Okay, let's go ahead and put your arm. Go ahead and relax your arm now. Okay, can you please... Can you relax, please? Okay. Reflex intact. Oh, no, wrong way. Let's go this way. Can you relax? Reflex intact. Now I'm going to check for your triceps. And I need you to relax your arm. Thank you. Good job. Reflex is intact. Relax. One more time. Okay. Reflex intact. Now I'm going to check for your patellar reflex in your knees. Can I have you scoot over just a little bit? Okay. And your other knee. Sorry. Intact. Now I'm going to check your Achilles tendon. I'm going to flex your foot up a little bit. And I'm going to hit the back on your Achilles, okay? Good job. Check your other foot. Okay, intact. Okay, now I'm going to have you, let's see your hands. I want you to push up against my hands. Good job. And let's go ahead and push up again. Good job. Motor strength is equal bilateral arms and squeeze my hands. Okay. And bilateral hand grips are intact and strong. Okay. Now I am going to have you stand up. And I'm going to have you face me. I'm going to have you bring your arms up and then back. Okay, and then I'm going to have you bring your arms up this way and then back behind your back. Okay, and then I want you to bring them up behind your back. Okay, good job. Range of motion, bilateral upper extremities are intact. Motion is smooth. Now I'm going to have you put your feet together, arms at side, and I'm going to have you close your eyes. And I don't want you to open your eyes till I let you know. Okay, go ahead and open your eyes. Patient with no swaying, balance was intact. And now I'm going to have you raise one leg. Okay, go ahead and put your leg down. Now I'm going to have you raise your other leg. Go ahead and put your leg down. No swaying involved. Motion intact. I'm going to have you turn around. And I'm going to have you bend forward. Hold on one moment. Go ahead and bend forward and touch your toes. Okay, spine is midline. Curvature, spinal curvature normal. Motion is smooth. And I'm just going to tie this back up for you. Now I want you to turn around and face me. And now I want you to walk towards me. And then I want you to turn around and walk back. And then go ahead and turn around and walk back. Gait is steady and smooth. And I'm going to have you sit